The Injex needle-free injector system is designed to provide a more comfortable option to traditional needles for people who take injections or administer injections to others. Injex may be used with insulin and other medications or vaccines that are delivered subcutaneously. This video will introduce you to the features of the Injex system and instruct you in its proper use. However, it is important to carefully review the supplied instruction manual for further details and precautions when using the Injex system. Your Injex starter kit contains one Injex 30 or Injex 50 needle-free injector, one compact reset box, 8 sterile Injex 30 or Injex 50 ampules, 2 sterile vial adapters, 1 vial of sodium chloride solution to be used for practice injections, 9 alcohol wipes, a warranty card with envelope, 1 Injex instruction manual and training video, and 1 Injex carrying case. The Injex needle-free injector is compact and easy to handle. Instead of using a needle, Injex propels a fine stream of medication through a tiny opening at the end of a disposable ampule. The medication is delivered through the skin and into the subcutaneous tissue. A safety interlock system helps prevent any accidental discharge of medication. The system comes with a reset box which automatically resets the injector each time the lid is closed. The Injex ampule is similar to a transparent syringe without a needle and is used to draw a single dose of medication from a medicine vial using a vial adapter. There are markings on the ampule indicating both U100 insulin units and milliliters. The scale on the Injex 30 ampule is marked from 5 to 30 units and 0.05 to 0.3 milliliters. The scale on the Injex 50 ampule is marked from 10 to 50 units and 0.10 to 0.5 milliliters. The Injex ampule is a single-use sterile component of the Injex system. Each ampule should be used once and then discarded in an ordinary trash receptacle. Repeated use of the ampule may cause wet shots or ampule failure and could result in injury to the user. The vial adapter allows the Injex ampule to be filled with medication directly from a vial without the use of a needle. The adapter fits most medication vials and has a tethered cap to help keep the vial top and contents clean and secure. Before beginning, wash your hands with soap and water. The first step in using the Injex system is to prepare the injector. Before using the system with your medication, we recommend that you practice this procedure with the vial of saline solution included in the starter kit. Read the manufacturer's insert before attempting the practice injection. We'll start by resetting the injector. Place the reset box on a flat surface with the hinge facing away from you. Hold the bottom half of the box with one hand and use the other hand to lift the cover of the box by grasping the lip of the top. Pull the lid open until it stops. Push the safety ring on the injector to the safe position before you insert the injector into the reset box. Place the injector into the reset box so that the open end of the injector is angled downward and fits over the push rod located toward the hinge of the reset box. Shut the lid of the reset box all the way until it snaps closed. Now, open the reset box and remove the injector by lifting the rear of the metal body of the injector. The injector is now set and ready to have the ampule loaded. Now it is time to draw the medication. Remove the vial adapter from the sterile package and remove the protective sleeve from the plastic spike on the adapter. The spike is sharp, so be sure to handle it carefully. Attach the vial adapter by placing it on top of the vial at an angle and pressing down firmly until the spike penetrates the rubber septum on the vial. The clamps on either side of the vial adapter should hook under the rim of the vial. The vial adapter should remain on the vial until empty, and then discarded with the vial. It is important to note that the vial adapter is designed for use with a single vial. Never use the same adapter on more than one vial. Twist the tethered cap on the vial adapter counterclockwise and lift off. Remove one Injex ampule from its sterile packaging, being careful not to touch the medication delivery end of the ampule. Make sure the ampule plunger is pushed all the way forward, and then pull back to the dose level that you will be drawing up. Put the Injex ampule in the open end of the vial adapter and turn clockwise until firmly in place. Push the air in the ampule into the vial while the vial sits upright. Then turn the vial upside down and slowly pull back the plunger until the correct amount of medication is drawn. Use the top edge of the outer ring on the ampule plunger tip as your measurement guide. After filling the ampule, look for air bubbles. If bubbles are visible, tap the side of the ampule until all bubbles are at the top of the ampule, and then push up to remove air bubbles. Be careful not to push any medication back into the vial. Then, pull the plunger down slowly to fill the ampule to the desired dose. Once the ampule is filled with the proper dose of medication, unscrew and remove the ampule from the vial adapter. Insert the plunger shaft of the ampule into the open end of the injector. Twist the ampule as far as it will go. The ampule must be twisted firmly all the way into the injector to disengage the automatic safety. Then, slide the safety ring into the safe off position, and the injector is ready for an injection. Before we review the injection technique, let's talk about special instructions for injecting with insulin. Injex ampules are designed for use with U100 insulin only. Patients using the Injex system with a single insulin type should follow the procedure as described in the previous section. However, some patients need to combine insulin types with different durations of efficacy. These insulins may be administered through one single Injex ampule if they are compatible according to manufacturer standards. We will now describe the procedure for drawing a mixed insulin dose. Again, make sure you have washed your hands with soap and water. Attach one vial adapter to each of the two vials, following the same procedure described in the previous section. Twist the tethered cap on each vial adapter counterclockwise and remove them. Remove one Injex ampule from its sterile package. Make sure the ampule plunger is pushed all the way forward, and then pull back to the dose level that you will be drawing up from the long-acting insulin. Put the ampule in the open end of the vial adapter on the long-acting insulin and turn clockwise until it is firmly in place. Now push the air into the vial. For right now, you will only push air into the vial. You will not draw the insulin yet. Remove the ampule from the long-acting insulin vial and then pull back the plunger to the desired dose level of the rapid-acting insulin. Attach the ampule to the vial adapter on the rapid-acting insulin and push the air into the vial. Now turn the vial upside down and draw the rapid-acting insulin into the ampule. Unscrew the ampule from the vial adapter. Now return to the long-acting insulin. Draw up the long-acting insulin, adding it to the rapid-acting insulin already in the ampule. Add the two numbers of units together to determine the correct total combined insulin dose. Draw back slowly to avoid getting air bubbles. Do not allow the mixed insulin to go back into the long-acting insulin vial. Unscrew the ampule and insert the ampule into the injector as previously described. Remember to reattach the tethered caps on the vial adapters to keep the vial tops and contents clean and secure. Before we move on, let's review the steps for mixing two insulins. Step 1. Add air to the long-acting insulin vial. Step 2. Add air to the rapid-acting insulin vial. Step 3. draw up the rapid-acting dose. Step 4. Draw up the long-acting dose. Selecting the site for your injection is very important. The Injex needle-free injector may be used at typical injection sites, including the arms, legs, abdomen, hips, and buttocks. You should select a site that is well developed with subcutaneous fatty tissue, and remember, you should never pinch up the skin. If you need help choosing your injection site, consult your healthcare professional or refer to your Injex instruction manual. Once you have selected your injection site, you are ready to learn the proper injection technique. First, clean the injection site using an antiseptic pad or an alcohol-saturated cotton ball. Be sure to let the alcohol dry. Next, with the ampule loaded with the correct dose and the safety ring in the safe off position, the injector is ready for injection. Hold the injector perpendicular to the injection site. Push the ampule tip firmly against the skin, applying enough pressure until the skin is slightly indented. When the injector is in the proper position, push the trigger release and hold the injector in place for 2 to 3 seconds. Then lift the injector from the skin. The ampule will leave a brief impression or footprint on the skin. After the injection, the skin around the site should not be stretched or pinched. If a small drop of blood appears, apply a cotton ball or spot bandage to the area. Remember, Injex ampules should be used only once and then discarded. Between uses, store your Injex needle-free injector system in the Injex carrying case. The 6 elastic bands on the left side of the case are designed to hold 1 packaged ampule each. Directly behind the 6 ampule bands is a pocket. This pocket may be used to store an extra packaged vial adapter, as well as bandages and alcohol wipes. There is also a smaller plastic pocket that may be used to place a business card or other form of identification. On the right side of the case, there are 2 elastic bands, each designed to hold 1 vial of medication with an attached vial adapter. When placed correctly, the vial adapters should be pointing toward each other in the case. To the right of the insulin vial bands is where the reset box is stored. Using supplied pieces of Velcro, you may attach the reset box to the carrying case to keep it securely in place and ready for use. To the right of the reset box, there are 2 thinner elastic bands. Your Injex injector may be stored in either of these bands. Your attention to this video and the instruction manual will help ensure safe and reliable operation of your Injex needle-free injector system. If you have additional questions regarding the use of your Injex needle-free injector system, contact the Equidine Systems Customer Care Center toll-free at 877-47-INJEX. Thank you for choosing the Injex needle-free injector system, the safe, effective, and gentle option for taking or giving injections.